Irritable bowel syndrome, IBS, is a chronic gastrointestinal disorder that affects the large intestine, colon. It is a common condition characterized by a group of symptoms that can vary from person to person and can range from mild to severe. The exact cause of IBS is not known, but it is believed to involve a combination of factors including abnormal muscle contractions in the colon, heightened sensitivity to intestinal pain, inflammation, and changes in the gut microbiota. Some common symptoms of IBS include abdominal pain or discomfort. This is the most common symptom, usually occurring in the lower abdomen. The pain may be cramp-like and can vary in intensity and duration. Altered bowel habits. IBS can cause changes in bowel movements. Some people with IBS experience diarrhea, IBSD, while others have constipation, IBSC. Some individuals may alternate between the two, IBS mixed. Changes in stool consistency. The stool may appear loose, watery, hard, or pellet-like. It may also contain mucus. Bloating and abdominal distension. Many individuals with IBS experience bloating, which is the feeling of increased abdominal pressure or fullness. Gas and flatulence. Excessive gas production and increased passage of gas through the rectum are common in IBS. Urgency or feeling of incomplete bowel movements. Some people with IBS may have a sense of urgency to have a bowel movement or feel that they haven't completely emptied their bowels. The exact causes of irritable bowel syndrome, IBS, are not fully understood, but it is believed to be a complex condition influenced by multiple factors. Here are some factors that may contribute to the development of IBS. Abnormal gastrointestinal motility. One of the main factors associated with IBS is abnormal muscle contractions in the intestines. In some individuals with IBS, the contractions may be stronger and longer lasting, leading to diarrhea, while in others, the contractions may be weaker, causing constipation. Intestinal inflammation. Low-grade inflammation in the intestines has been observed in some individuals with IBS. This inflammation can contribute to the hypersensitivity and pain experienced in the gastrointestinal tract. Changes in gut microbiota. The gut is home to trillions of bacteria and other microorganisms collectively known as the gut microbiota. Alterations in the composition and diversity of the gut microbiota have been associated with IBS. It is thought that these changes may affect the communication between the gut and the brain, leading to symptoms. Intestinal hypersensitivity. People with IBS tend to have a heightened sensitivity to pain and discomfort in their intestines. Even normal bowel contractions that wouldn't typically be felt by others can cause significant pain and discomfort in individuals with IBS. Food intolerances and sensitivities. Certain foods and drinks, such as high-fat foods, spicy foods, caffeine, alcohol, and gas-producing foods, can trigger or worsen symptoms in some people with IBS. Food intolerances, such as lactose intolerance or fructose malabsorption, can also contribute to symptoms. Psychological factors. Psychological factors, such as stress, anxiety, and depression, can influence the functioning of the digestive system. Many people with IBS report that their symptoms are triggered or aggravated during periods of increased stress or emotional distress. The treatment of irritable bowel syndrome, IBS, aims to alleviate symptoms, improve quality of life, and help individuals manage the condition effectively. The treatment approach may vary depending on the specific symptoms and needs of the individual. Here are some common strategies and treatment options for IBS. Lifestyle and dietary modifications. Dietary changes. Identifying and avoiding trigger foods or food intolerances can help reduce symptoms. Common triggers include fatty foods, spicy foods, caffeine, alcohol, and gas-producing foods. A healthcare professional may recommend following a low FODMAP, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols diet, which involves temporarily avoiding certain carbohydrates that can trigger symptoms. Eating pattern modifications. Eating smaller, more frequent meals and avoiding large meals can help manage symptoms. Fiber intake. Gradually increasing dietary fiber or taking fiber supplements may improve symptoms, particularly for individuals with constipation-dominant IBS, IBS-C. However, fiber intake should be individualized, as some individuals with IBS may be sensitive to certain types of fiber. Stress management. Stress reduction techniques. Stress management techniques such as relaxation exercises, deep breathing, meditation, and yoga may help alleviate symptoms and manage stress-related triggers. Cognitive behavioral therapy, CBT can help individuals with IBS identify and modify negative thought patterns and behaviors that contribute to symptom exacerbation. Antispasmodics. Medications that help reduce intestinal muscle spasms and pain may be prescribed to relieve abdominal cramping. Antidiarrheal agents. These medications can be used to manage diarrhea in individuals with IBS-D. Laxatives. For individuals with IBS-C, certain laxatives or stool softeners may be recommended to relieve constipation. Probiotics. Probiotics, which are beneficial bacteria, may help restore the balance of gut microbiota and alleviate symptoms in some individuals with IBS. Medications for specific symptoms. Other medications may be prescribed to address specific symptoms such as abdominal pain, bloating, or excessive gas.